Alrighty, so wrapping up with the boys, again, we got the testes, scrotum, epididymis. It's important though, I forgot to point out this vas deferens right here. This is where we get the key term for vasectomy. If a male no longer wishes to be able to reproduce, if we cut off the reproductive cell, which is the sperm, if they can't leave the epididymis, we simply snip the vas deferens and they have nowhere to go. They just stay in there. Then that you would still have the semen, the fluids, but there would be no sperm in it. It would still be ejaculated through the penis. So the penis is the external sex organ. This is what delivers the sperm to the woman's reproductive system. It does have to be erect. Technically, males produce sperm through their entire lives. So as long as you have erectile function of your penis, you could get someone pregnant that was able to become pregnant. Saying that means when you get older, there is such thing as erectile dysfunction, and then they would have problems in delivering the reproductive cell to the female reproductive organs. Usually when males are born, there's something called foreskin on the tip of the penis, and for whatever reason, someone way back when decided this is really annoying, it's getting in my way, and they cut it off. And that's where we get circumcisions done when babies are born. They're usually circumcised, and that just means that the foreskin at the tip of the penis was cut off after the baby was a couple days old. And I mean, it doesn't have to be cut off. There are some cultures that don't believe that you should, deform your body by cutting parts of it off. But it just makes it easier to keep clean. Having that foreskin covering the front just leaves more room for infection and stuff to grow. So it's just become a proper practice now that most babies are circumcised. But again, you don't have to. Some religions don't believe in it. So keeping your reproductive system healthy. Cleanliness, again, you can get fungal infections anywhere on the body that kind of has like tight, warm crevices. So that just goes to show for reproductive systems as well, that we need to keep them squeaky clean and use soap and water and things that we should already know. But sexual abstinence is going to reduce your chances of getting an STD or STI, which could cause serious problems for you in the future and your reproductive system. A lot of them could also cause, fertility issues. Protection from trauma. Again, your testicles are housed outside of your body because they need that certain temperature to keep the sperm alive. So wearing the appropriate protective equipment when playing sports, trying not to get hit there, if at all possible. There's a lot of nerves because, again, they're very sensitive to temperature and it moves up and down. So the nerves go all the way up into the abdomen, and that's why when boys get hit in the testicles, they will usually end up in a lot of pain on the floor. It goes straight up into their gut and it makes them feel like they could possibly vomit. It's extremely painful. There's a lot of nerves on the scrotum and testicles. So protecting them from trauma is super important because you can lose them if you get enough serious trauma. And then giving yourself self-exams. For the boys, the doctor is going to have to check your prostate. You unfortunately can't do it yourself. It's very far up there. But you can give yourself testicular exams and, just like a woman would do for her breasts. You just feel the testicles, make sure there's no abnormal lumps and bumps. It's normal to know what your body should feel like. And that is, the first step to preventing testicular cancer is recognizing when something's wrong. So if you've never explored and felt the normal testicles, then you wouldn't know what cancer felt like. So your doctor has probably already told you that you should be checking yourself regularly. It doesn't have to be every day, but if you're just like in the shower cleaning, it's fine to feel around and just make sure that everything still feels the way it should. Moving on to the ladies. The ladies, again, there's 3 different functions for this reproductive system. And I apologize for the bad picture, but it's really hard to find like 2D pictures that show everything, but they don't show too much detail. I don't want to make people feel too uncomfortable, so I like this one. It has a nice pink color too. So functions produce sex hormones. The female sex hormone is estrogen, and there is progesterone as well. And we'll talk about what the difference is between those two. Your job is to produce eggs, and that is your reproductive cell. And you provide a nourishing environment in which a fertilized egg can develop into a baby. And that is going to be the function of your uterus. We'll talk about that more. But the 2 hormones that I was talking about, you have estrogen, and that is when you get physical puberty changes, and it controls the maturation of your eggs. So when you go into puberty, your estrogen levels will increase. You'll get your first period or menstrual cycle, and that's when your eggs start to mature and you start to become fertile. You cannot get pregnant before you've had that first menstruation cycle. The progesterone activates change to a woman's reproductive system before and during pregnancy. So that just basically makes the uterus a overall good housing unit for the baby. It signals to the body that we're getting ready for pregnancy or that we are pregnant, and then you will no longer get your period while you are pregnant. Everything stays inside the uterus until the baby is born. There is some cases where people have spotted during pregnancy and it's healthy, but normally there's little to no bleeding at all when you're pregnant with a baby. Girls are born with immature eggs in their ovaries, and you're born with as many as you're going to get. You're not going to produce more like the males were producing with the sperm. So you roughly are born with about 400 eggs, which maybe doesn't seem like a lot, but we also have to remember that women aren't going to be fertile their entire lives. And again, it's going to be different for people. Some people have fertility issues because they just they maybe weren't born with a lot of eggs, or they didn't mature properly. There's lots of reasons. But once puberty begins, the eggs start to mature or ripen, and they are released once a month during ovulation. And we'll talk about ovulation and where that is in the menstrual cycle in a little bit. The eggs themselves are no bigger than a period at the end of a sentence. So when you're like typing the little period, that's about as big as an egg is. It's very, very small. So the eggs are stored in your ovaries. You usually have 2 for whatever reason. You could have 1, similar to the boy's testicles. You could have trauma and lose 1. You could have an egg implant in the fallopian tube, and that would cause the loss of the fallopian tube because it would be called an ectopic pregnancy. But there's lots of different, again, reasons that someone would have fertility issues. But the eggs are in the ovaries, and they would be released then into the fallopian tubes. It's important to point out that not each ovary is going to release an egg every month. It'll usually be one or the other. So when the sperm enters the body, they pretty much got a 50-50 shot on which fallopian tube has the egg, because they're not going to know. So literally half the sperm are going to swim the wrong way, which is why there's so many of them, to try to increase our chances of fertilization of the egg. So again, the fallopian tubes are just passageways that carry the egg away from the ovaries. You don't want the egg to implant here again. That would cause issues. Unlike the sperm, eggs can't swim. We talked about the sperm kind of having like, they have like those tails and they can swim, they can jump. They're moving in the semen and now the vaginal area, and they have room to swim. The eggs can't swim. So inside this fallopian tube, you're going to have those little cilia that we talked about that were in your lungs. Those are also in here, and they help push and move the egg because we want the egg to be fertilized and implant inside the uterus. This is the muscle that's going to stretch and grow as baby grows. So again, the uterus is hollow, it's muscular, it's a pear-shaped organ. This is where a fertilized egg will grow and develop. So usually the egg and the sperm will meet somewhere in this passageway, assuming that this ovary released the egg. We'll watch the process of fertilization. I'll attach the video for you. And then it'll find itself, nestled in on one of the sides of the uteruses, and then the body will have a signal that says, I'm pregnant. I no longer need to get my period and shed my uterine lining, and that's why not getting your menstrual cycle is a really big tip for women, that they might be pregnant and they should take a pregnancy test. But again, if we accidentally implant in the fallopian tube and the baby will start, you'll still get the same sign. Like it'll say you're pregnant, you'll have the hormones of a pregnant lady, but the baby will start to grow in here and it'll eventually have nowhere to go. It's painful, it's very dangerous, you'll need immediate surgery, and sometimes the fallopian tube cannot be saved. So that can happen, but most of the time it finds its way where it's supposed to be and ends up implanting in the uterus.